Hello and welcome to the Addition Technology Intacs and Intacs XL training video. Addition Technology, global leader in corneal science and implant technology, is in constant search for new and effective technologies to improve keratoconic care. The Intacs SK and standard intracorneal rings have helped improve the quality of vision for many patients and has delayed or eliminated the need for corneal transplants with great success. We have now developed the Intacs XL corneal cross-linking therapy to enhance corneal stability by combining its performance with the success of the intracorneal ring. As a result of years of research and with the assistance of Dr. Jimena Núñez at the Clínica Oftalmológica de Cali, we have created this demonstration video to guide you in the understanding and performance of the Intacs intracorneal rings as well as the Intacs XL corneal cross-linking procedures. Dr. Maria Jimena Núñez did her ophthalmology residence at the University del Valle, Cali, Colombia, where she also completed a fellowship in cornea and refractive surgery. She has a clinical practice at the Clínica de Oftalmología de Cali, Colombia, as a member of its cornea and refractive surgery unit. She is currently a professor at the Faculty of Medicine, Universidad Javeriana Cali, and she has been working in the Vision Sana research group for the past 7 years in ocular surface, corneal topography, diagnostic tests, and treatment for keratoconus. Addition Technology would like to thank the Clínica Oftalmológica de Cali and Dr. Jimena Núñez for their dedication, patience, and commitment to corneal science. Thank you. Intacs XL cross-linking procedure. We will be performing cross-linking on a patient that has had previous intracorneal ring surgery. The curvature map shows rings placed at 6 millimeters and a centering of the power of the cone. In the axial map, we can observe a symmetric bow tie with the steepest meridian at 112 degrees and the thinnest part of the cornea at 399 microns. The procedure is initiated with previous asepsis and antisepsia to avoid contamination of the surgical area. Prophylaxis is performed with povidone iodine at 10% on the eyelids and 5% in the ocular surface for 5 minutes. We prepare the syringes with alcohol, distilled water, and riboflavin. First, we apply anesthesia. Afterwards, we place the guiding trephine for the application of the alcohol to remove the epithelium. The alcohol is left for 30 seconds, removing the excess to avoid spilling over the conjunctiva, which could increase the postoperative pain. We perform a profuse rinsing of the ocular surface with distilled water and then remove the epithelium with the spatula inside and outside the area of the rings without touching the area of incision. We then take a pachymetry reading, which in this case is 360 microns. And since it is below 400 microns, hypotonic riboflavin should be used. 1 drop every 3 minutes should be applied. At minute 15, pachymetry is performed, making sure the pachymetry tip is well cleaned from riboflavin residue to avoid false readings. In this case, the measurement was 314 microns. At minute 30, the pachymetry is 282 microns. A portable slit lamp is used to check the anterior chamber for presence of riboflavin. Before irradiating, we must make sure the cornea is at least 400 microns. We proceed to swell the cornea with pumping of riboflavin drops, 1 drop every 20 seconds for 5 minutes. When using isotonic riboflavin, the swelling is performed with distilled water. When the cornea reaches 400 microns, we initiate the irradiation process with the Intax XL UV lamp at 3 milliwatts per centimeter square for 30 minutes, making sure the UV lamp is centered in the cornea at a distance of 5 millimeters. Placing 1 drop of hypotonic riboflavin every 3 minutes with 1 drop distilled water every minute in between to avoid corneal desiccation. At minute 15, we noticed that the pachymetry was reduced to 320 microns, at which point a perfused irrigation was performed and a subsequent pachymetry revealed an increase in the thickness to 350 microns, at which time we proceed with the irradiation, the riboflavin and distilled water until minute 30, when the Intax XL automatically shuts off. The cornea is rinsed off with distilled water and a final pachymetry of 354 microns is measured, and anti-inflammatory and antibiotic drops are applied to the patient's eye, as well as a contact lens placed to protect the cornea.